the way that they're breathing. So really good.
Fantastic. And what's the age range?
So really good. Said, it's literally from days old up till the oldest of our patients that we'll be using this for. This model we do have a weight, so it's 5 kilos to begin with on this particular model. But we use Vapotherm every single day on nearly every single ward. And the ICUs to
It's also called high flow.
high flow.
Yeah. You work on Ward 11?
I worked on Ward 12 for 12 years, so that's our high dependency ward. So I've used Vapotherm a lot. Yeah.
Sorry. Oh, brilliant. And then children can go on to CPAP after as well.
Yeah, so if the Vapotherm isn't enough for them, so if the children's airways are kind of closing down when they're taking their breaths out, sometimes they're very poorly or they're very weak and the airways can close, and then it's really tough to reopen those airways. We'd probably escalate onto CPAP, which is continuous positive airway pressure. So it really it's the next step up with interventions. But this is definitely a step in. This helps the children to not have to escalate onto the CPAP, which is a bit more invasive and uncomfortable at times.
Well, thank you all so much for your support. This is clearly a wonderful piece of equipment.
So what you just said a little bit, if they actually react positively to this, then they don't have to move to the other one.
So it does depend on why they're on this. So it's definitely for those acute kind of viruses that this is really, really helpful in stopping that escalation. But if it is that the children have got other complications, if they've got airway complications, or if they've got sometimes, but it is dependent on the reason why. So it might be that some children will need to go onto CPAP regardless, because that's just the treatment that they require. But this is definitely an intermittent treatment that we can use. Or it can be, we would try this first and see how they got on, and then if it didn't work, we'd escalate.
Did you say adults can use it as well then?
So our older patients do use it, yeah. So obviously we only look after children between kind of like 16 and 17 is our oldest really in our children's wards. But yeah, we do have them on them. Yeah, and the asthmatics that come in as well, really good for children with asthma. We've had quite a few of those on there. So there's multiple reasons why they could use it.
One more question. I haven't given you many, but is there a time limit that they would be, on this maximum?
Not a maximum. No, it's dependent on the child's condition and why they need it. So I've looked after children that have been on the Vapotherm for a long, long time until they've had further surgeries. It could be a couple of months, or until they've grown as well. So actually, when children grow, their airways are growing all the time. We don't have like kind of normal grown airways until we're about 7. So actually, if we just give them a bit of time and they do the work and we help them with that, then sometimes they can wean off it as well without any further intervention. But it's all dependent on why they need it. Yeah.
And what's the maintenance? Is there annual contracts, or how does it work on that?
These questions aren't for me. I just use the But we've got a team of medical physics team that will come in and make sure that it all gets serviced and it's all up to scratch and everything's safe to use as we go along. Yeah.
And we always build that in too. So whenever we get involved in fundraising for equipment, we ensure that we work with the trust to make sure that there's a continuity for that piece of equipment. So it's not we bought this, it's in, but now there isn't a plan going forward.
Well, I'm asking, what would be the life of this machine? Because if it comes to an end and then you've got nothing to replace.
No. So some of these are replacements for machines that have become obsolete or could do with an upgrade. But yeah, there isn't the understanding is that we work with the trust to make sure that we'll help get it in, but then the responsibility of the maintenance, the kind of repairs and the overall running of whether it's an equipment or a space or an area is very much embedded within the trust or the areas that benefit from the donation. So, yeah.
And is it? We were saying it's 4 Vapotherms. Yeah. Okay. So it's lovely to see everybody.